Hello, and welcome to a video series explaining consent to trial. This is a video intended for young patients with cancer and their parents who have been asked to take part in a clinical trial. The process of consent can be intimidating and confusing, and this video is to try and help make the process easier to understand. To give consent is to agree to something. It is a legal process by which patients allow doctors to give them treatments. In consent to trial, giving consent is agreeing to take part in that trial. This means agreeing to be assigned to one of the treatments being studied in the trial, and allowing some of the data collected about you to be used in the trial's results. If you agree, or consent, to take part in a trial and then change your mind, you can simply withdraw your consent and can be removed from the trial. You can't properly agree to something unless you know it is what you're agreeing to. This, in a nutshell, is what informed consent is about. Before a doctor can accept consent from a patient or parent, they must be sure they know what it is they are consenting to. Before you can consent for you or your child to be in a trial, some important things to know about the trial may be: what's the aim of the study? How's the study being performed? Who has commissioned the study? What will the benefits of the study be? What are the risks? How will my child be followed up? And if I want to, how do I go about leaving the study? Children cannot consent to themselves being in a trial. This must be done by someone with parental responsibility. If you're a child's mum or dad, then you have parental responsibility and can give consent. Sometimes, in cases like step-parents, or when parents disagree, things can get a bit more complicated. If you're unsure if you can give valid consent, it's important to check with your doctor. Although legally it must be a guardian, children are involved in the consent process too. As long as they are old enough to understand what it means to be in a trial, they will be asked if they are happy to take part, and if not, they won't be enrolled. To give consent for your child, you also need to be competent to do so. This is called having capacity. Usually there's no problem with this, but doctors have to check 4 things before they can take consent from someone. Firstly, they need to find out that they are able to receive the information being given to them and retain it for long enough to use it. Then, they need to check they understand the information given to them. They need to be sure that they can weigh up this information to make a decision. And finally, they need to be able to effectively communicate this decision back to their doctor. Giving consent can be done in a number of ways. It can be implied, spoken, or written down. In a trial, consent is almost always written. Consenting to your child entering a trial will involve sitting down with a doctor or specialist nurse and filling out some paperwork. They will check that you have understood what it is you are giving consent for and answer any questions you have. You'll need to sign some forms to document this consent. Thank you for watching this video. I hope it helped you understand the consent process. 2 other videos are available in this series, one that explains how trials work, and another that explains the rights of participants and what happens to their data. You can access them below.